Good afternoon, everyone. I hope you can hear us. There should be recording and transcription on, so if you want to watch it afterwards or share it, we're hoping to get a YouTube channel set up shortly, so we will be publishing this very soon. We are going to get going now, and I'm going to hand over to Jen.
Thanks, Jeanette. So I was going to start off with, I'll take you quickly through the agenda, if I can have the next slide, please. But before we do that, it's a heat wave right now, and we found an article about how heat waves actually hit women harder. And we thought this might actually be a really useful and interesting way to start. So we have got biological differences. We regulate our heat differently. If we're pregnant or we have other hormonal things going on in our lives, menopause, perimenopause, heat can affect us very, very differently. We quite often care for family members, children, unwell, older adults, etc., who have to put their own needs first. And we're also likely to live in lower income households with less access to the cooling and space. So what I wanted just to do is, through the use of some emojis, does anyone want to share in the chat or share react on the screen about how they're currently feeling from the heat wave? How are you coping? Are you coping all right? Yeah, I'm in the office today with no air conditioning, so for me it is very, very hot and stuffy, and I have one little fan pointing at me, and hopefully that will get me through the next hour. It is really tiring, so appreciate people taking the time today to check in with us, and I hope you've all got somewhere cool to sit while you do this with us and have a nice drink as you're going. And it's a chance to take your hands away from your keyboards and mouse, just listen and have a drink. So I was going to take you on and start a little bit with a little bit of fun. So are we able to move on? I completely forgot the agenda, didn't I? I'm doing really well. What I was going to do is have a little bit of a game with you. So what I'm going to ask you all to do, we're going to have a live example. Get your fingers ready. So I'm going to give you a warning now. Get your favorite AI tool open and ready. And I want you to ask it a question. Can you ask it this question? Please, can you generate an image of an analyst? And I'm quite keen to see what everybody got. So I appreciate I'm asking you to open your preferred AI tool, but if you're at work like me using a work computer, there's an approved AI tool, which might not be your preferred one. So I don't want you to do anything that you shouldn't be doing. But has everybody, if you give me a thumbs up if you've now got it to generate an image of an analyst. Now, whilst that's churning through, because I know mine takes a little while to actually generate a new image, if we go on to the next slide, I'm going to show you what I tend to get. We have the next slide, please, Jeanette. Everybody gets this guy. Oh, we got one female. 2 females. It's improving. That is fascinating. So I would like to know who used Copilot, who used ChatGPT. It's interesting, it's always the same guy and the same woman, but in slightly different poses.
Slightly different graphics in front of them.
Yeah.
Yeah, very similar.
So we've all got fairly similar. Oh, we've got a different guy. Claude's come up with someone new. Now, what I'm curious about is how, for those of us, I'll just start with Copilot. For those of us that used Copilot, how we all ended up with different people when we asked the same AI tool the same question. I find that quite curious. because you'd have thought it would do the same piece of work and come out with the same answer, and it doesn't. And the other bit I'm kind of curious about is what seems to be happening here is I'm seeing a much better mix of women represented for analytics. I did this as a little game with the Women in Health Network a few weeks back when we were playing with this concept, and our first image generated was almost all male. It was pretty much this guy in a number of different poses. So I'm really curious, has there anyone got any theories as to why the same model, the same tool comes out with different people and how that's working?
I think, sorry if I don't mind just jumping in, I think I put in into two. I didn't use Copilot, I used ChatGPT and Claude, and Claude seems to have given me both females. And I think it's because it knows, and my memory settings are turned on. So all the discussions I've had with it, it's probably related to that. But I'm wondering if someone went in cold without any history. Yeah, based on personal usage, that it's.
So this is evidence that our AI tools are learning from us. They're learning about us and they are learning from us. And that's a really powerful thing. I'm willing to bet if you started asking about more generic job descriptions like a nurse, a chief exec, a banker, she says, saying that very carefully, it would probably become much more stereotypical because they won't be questions we've actually asked. So I think it starts to learn from us, but only in certain areas. So if we move on to the next slide, when Jeanette stopped laughing at me. I then asked my AI tool, what is AI? Can you tell me what AI is for people who wouldn't know in real simple terms? And it talked about a computer system that learns from information and helps people make decisions. That's a lovely tagline, almost AI generated if I was going to be honest. Looks at lots of information, finds patterns and learns, and gives helpful answers or ideas. So I think what we've just seen is how it finds the patterns and learns, because it's giving a bespoke answer to different people. So some of us got the same generic guy, but actually we started to see some variation coming through. I think the key to using AI is actually understanding that. So it looks at lots of information. So the first bit we can control is what information we ask it to look at. So you can say, please look at only NHS analysts, or please look at only UK analysts. So you can start to be much more specific about what types of data you want it to look at. I think the more you use it, the more it learns about you and the sorts of questions you ask. So I actually have asked, I had to use a different AI tool for my question because I'd asked my normal one so many times this question preparing for this that it started giving me lots of different answers. Actually, that's evidence it learns, and it's learning about me. And I think Kay and Jeanette found the same thing as they were doing it. So I think that's really interesting. If the majority of the examples on the internet are male, in the types of pictures and images it can see, it's more likely to generate a male image. So the more we ask it, the more we say, please, why have you given me a man? Why have you chosen to do this? The more we challenge and ask it, the more it's likely to train itself, not just our own version of it, but the whole tool itself will start to look at generating different things. Has anyone got any thoughts or comments on some of that? I'm trying to read the chat as well at the same time, which I'm struggling to do.
Yeah. Interestingly enough, I while you were talking, I know someone's got their hand up. I don't use Grok much, but I have dabbled in it, which is the X's version of their AI, and I put it in there, and it doesn't have history on me, and I don't use it. I think I've used it for random stuff just to over time. And yeah, you're absolutely right, Jen. It gave me an image, whereas the others, which ChatGPT and Claude, that have history on me, gave me female. If I went in cold, Grok gave me a male, which is what I don't use. So that theory is that as they learn more about you, it's geared towards you. And I've noticed that the images that I got from Claude and ChatGPT, they were of coloured women. So the diversity element has been picked up in there as well as how it picks up. So it's very interesting. Sorry, I know people have someone's got their hand up, so I'm going to shut up now.
I want to see the name of who. Is it Hazel?
Yes, it is Hazel. Thank you. Sorry, my camera doesn't work, but
Fine.
I went on Claude after being on ChatGPT. I normally use ChatGPT for my personal stuff, and I'm not using the work computer. I'm using my personal device for those that may ask. So it initially said, Claude initially said it was not able to generate or create images. That's outside what it could do, but it found images on the internet, on websites, and then it directed me to use tools like DAL via ChatGPT, Midjourney, or Adobe Firefly, because that's what's perfect for this. So it's quite interesting.
Yeah, I think that is really interesting. I think it shows that whilst we look at these tools, they're not all equal, and different tools are going to be better at different things. And I think it really starts to teach us about really think about the questions we're asking and be specific about what sorts of results we want to see. And the more we do that with our preferred tool, the more we will train it so that it starts to give us more usable answers. Now, that's only affecting ourselves. That's not actually affecting the wider internet. So if my male colleague did the same search, what I've taught mine wouldn't affect his outcomes. And that's the bit that I think as a Women in Health Data Network, we need to start thinking about what are the things we can do that might affect that, and why might that matter? Because otherwise marketing material will automatically be the same little group of icons that are completely gender neutral and ethnicity neutral, and we've seen the same groups of people that get generated from these things, or they switch to the gender bias. And I don't know how we're actually going to go about influencing some of that. Kay?
Yes, I was just going to ask everyone on there that I think this is really interesting information and what's come in through the chats and our conversations. And if everyone is okay, if they're not, please raise your hands, that we can do a little thought piece on this, because I think we've gathered quite a little bit of evidence. I know we've been working in ourselves to look at the differences, but what's come in through the chat is really, really interesting. And I think if anyone has any objections as to where we shouldn't be using, obviously we won't name names, but the different AI tools and what they've generated, to do a little bit of a thought piece article for our network. Is that okay? So if anyone has an issue, please do raise that objection if we are able to use this. Okay, brilliant. Is that okay, Jen?
Yeah, I think that,
because I think this is really amazing material for a write-up.
Yeah, and I think quite an interesting little live test. I was expecting everyone to have the same guy, and that's quite interesting that we didn't, which shows we're using AI and we're training it as we go. Right, I'm going to hand over now to Kay.
Okay, what's not next on the agenda if we put in, so I know, Jeanette, we've got the slide. Right. Okay, I'll lower my hand. So going into the theme of AI, we're going to look at something that I've been involved in heavily. So for those of you who may not have been aware, this week is London Data Week, and myself, from a key analytics perspective, which is the organisation I run. And for those of you who don't know me already, I'm Kay, part of the Women in Health Data Steering Group. So I took part on Tuesday, which was 2 days ago, held a workshop at London Data Week to look at primary care information about GP practices in London, specifically because it was London Data Week. So one of the questions that we asked, we looked at traditional dashboards, and then we went on to AI, and we asked traditional AIs and an AI agent built on top of the data to see if it would give us some results. So I'm going to share my screen to show you what we presented. So just to, there we go. So I'm sharing my screen right now, and hopefully you guys can see our dashboard, which shows a map of London and the various GP practices. We have approximately 1,200 practices, according to the data, in London, with about 11 million patients registered at various practices. If we hone in onto the practices, you can see the list size and the name of the organization. And I'm just going to zoom in and just try to have a look at, and the bubbles represent the size of the list size of the registered patients. So we can see some large ones here, Nexus Health Group, there's one here, Lewisham Care Practice, there's quite a big bubble here, GP at Hand, with 94,000 patients registered. Interesting, the registered list size, if we scroll across, I do remember seeing one very big one here, GP Pathfinders. And we know through our knowledge of primary care that, you know, some of the demographics, some of the way that the practices are run, digital, online, etc., are different. But what we're really interested in here is the proportion of females. So you can see on a bar graph here that you have kind of a fairly evenish split in terms of age group and gender in terms of percentages across London, with the highest age group being between 30 and 39, but similar age groups, slight increase in older patients in females. But what I was interested in, this sits on top of primary care demographic information. Some of you may be used to seeing some of that. GP practice list population sizes are published every month. So this is this information. But what we did at London Data Week was, right, one of the questions that we came up, and I'd like you all to be able to pop this into your AI of choice. So in the way that you did for generate an image, I'm just going to pop that into the chat. Which GP practice in London has the highest proportion of female patients? So we're asking about the patient proportion, not the numbers, because this is where we want to know which practice has the highest proportion of females here. So I'd be interested to see what answers you get from a generic AI as opposed to a AI agent which is built directly on top of that data. So if you don't mind popping that question, since we're on AI mode, to see if your Claudes or your ChatGPTs or your co-pilots can give you some accurate answers around the proportions. What does it know and what doesn't it know? And then I'll flip over to the AI agent that is built here on top of the actual data to see some of the results that we've got. Yeah. So Jen, you're seeing it can't reliably tell you, but it's telling you how to work it out, which is not very helpful. Anyone got practice to say that this practice? Okay, someone has got, based on latest, there isn't a published ranking identifying London with the highest proportion of females. Da, 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 da. Yep, it gives you that information. It's diverting us to an open data set. Yep, it's telling you how to do it and where to go to get that information. So we can safely say some of those high-level demographics around gender aren't available through where our traditional AIs that are out there. So what I'm going to show you is the AI agent that is sat on top of the data, where we've actually prepared the data for this type of questioning. And we called it Health Hack Your GP, but it's it's an exploratory tool which allows you to be able to ask that question. So I'm just loading the data agent, and some of you are familiar with data. It has all the tables that you might be able to identify age, a registered GP. I'll just ignore that one, GP practice. So we're looking at this one here, which GP practice demographics, age, gender, etc. So if I just pop that to the side, so it's built specifically with data in there. So part of the questioning we had for it, this is the data agent. I hope you can see that. One of the questions we asked was, so same question, which practice in London has the highest proportion of female patients? So it gave back this answer. The London GP with the practice with the highest proportion of female patients is this one, Nightingale practice, which has a female proportion of about 70% total register. So it's quite a small practice, but a high proportion of females there. So it starts to give us, so because we've given it some instructions, over 70% of the patients are female, which is unusually high for a general practice. Now, we need to obviously verify. We're hoping that it's picking it up from the actual data. High females. And then we went on to ask it, can you find out more about this practice and why it has a higher proportion of females? Because that's the next step. So it's given us some context here. So it's able to do that. So this is what it's found out about the Nightingale practice. It looks like a big chunk of registered patients are older women. So this goes in line with that graphic we saw, the visual, which showed that actually the female demographics increase. Anything else that anyone's noticed from this information? Talks about care homes and close to retirement housing, possibly. So this is just to give you an idea, a flavor of what is available on AI in the outside world and what the benefit is of when you shape your data for AI and are able to use tools like this to be able to build AI agents on top of your actual data. So I think it's worth sorry, that I don't know if you can hear that in the background. That's my dog having a little hack. Don't blame them. I brought her inside because she's very hot. So just to give you the power of when you're working with your colleagues, how important it is to have this kind of explore. This is obviously NHS open data, and we've shaped the data, made sure that it's got the right instructions. It understands the relationships between what is the tables, the information in there. Yeah, seem to be 3 or more correct sources to use it as patients registered GP practice from NHS England. Yep, monthly data. And we can do that. You know, the dashboard that we have has the ability to be able to. Sometimes, for those of you who are building a dashboard, it's hard to know what to put onto the dashboard. Is it information overload? This has basic information, but if anyone wants, we can start to look at their practice. So if you put your practice name in, I could quickly go and have a look at to see if we can search your practice. So is anyone happy for me to look at their proportion of females in this practice? If you pop the name on the chat, we can have a look individually. Archway. So that one is Archway Medical Practice. Is it Medical Centre N19 by any chance? Because there's quite a few archways.
Yes, that's the one.
Yeah, okay. So if I press go on here, let's have a look at some of the visuals that would come up here on that. So you have quite a large practice as of June 2026. It's average in your PCN is about 12,000. and you have around, it's not a, yeah, are you located, you have quite a young population registered? Do you know in this age group, there's certainly more females. Any local knowledge that you might have on this?
Sorry, I'm busy typing, thinking my mic is not working.
Yeah, no
It's a
worries.
virtual clinic. It's a virtual clinic where they do video, telephone, and face-to-face consultations. So most younger
Interesting.
people are registering as a result.
Interesting. Yes, that's what we're finding. Some of the larger practices have that digital first type of methodology, which does that. So yeah, equal split between male and females, but higher in the younger female 20 to 29 age group on there, visibly different. Sorry, I've got some more here. We can, if you've got, oh yeah, no, that wouldn't cover Wales, but it's certainly evergreen. Sorry, I'm not taking it in by, I'll put evergreen in. Let's have a look at your practice. Let's do a search here. Evergreen, is this one, it's the evergreen surgery. This one here, I believe.
Yeah, that's the right one. Thank you.
Okay. 10,000 patients registered, 51% female, slightly higher. Again, you can see the age group is quite an even split between the two, but actually you can see the older patients are higher. You can see that quite clearly. So there is something around older age groups and being higher in the female segment. Any thoughts on that? Females tend to live longer. Is that something that we can say safely?
Yeah.
Hence,
So life expectancy for females tends to be longer. I think it might also be really interesting to look at the particular area where the postcodes for that practice actually live. So the patients, so what's their particular postcode and how far away from it are they? So that that previous example where there's an awful lot of technology involved, the patients might not live that close to the area, whereas the more you've got an older population, the chances are they do live closer. And then it'd be useful to look at some of the ONS demographics for that particular area as well and go, is this practice representative? Because if you've got high older female adults living in an area and low representation in the local GP practice, that might indicate that access to services for those women is not good.
Yeah.
So that might be an interesting thing to be able to pull different bits of data together into this to explore further, because that's the whole point of being able to explore the data, is to find where there may be things that are a problem that we want to start to look at how we address.
Yeah. Princeway, someone put that in there. This is what it looks like, slightly higher female population. You're absolutely right. This becomes really powerful when you start to overlay the local services that are there, care homes, demographics, deprivation, all of that information is, and then to bring in things like cervical screening rates, which is also an open data set, which we have in the background, but for the purpose of this, we just wanted to focus in on the demographics. So I think somebody had their hand up. I just want to make sure that I haven't missed them. I'm pretty sure that
It was me, sorry, Catherine. It was, no, I was just going to say that Wanstead, my uncle area actually, there's actually a lot of care homes there. And what they do, I know this for someone who's just gone into one of them, they actually register with my practice from the care homes. So the care is at least two next to each other. All of their residents would be are registered in the one practice. So that might explain it as well. But yeah, it was just a bit of context.
Yeah, and I think this is a really interesting topic, and we had this event it was on Tuesday, but we're hoping the week happens that actually we get involved from a Women in Health Data Network perspective. So if the group, as all of us collectively, can think of some ideas that we can go in and to share with the wider public about primary care data. I was speaking to Jeanette earlier, and we were talking about how when you work in the NHS, actually we are in our kind of bubble. We know what PCN means, we know what registered list size means, we assume all things, but public about the NHS bubble, especially the data side of things. So I think it will be really good if we, as the network, Women in Health Data Network, can be represented here on something similar. Obviously, this has been around GP practices, but to hone in around some of the health inequalities, specifically from a female perspective, what kind of topic would be really good for Women in Health Data Network to host at this event this time next year? And if anyone is of interest of getting involved, please do, if you have an idea that we could use we've got plenty of time, so it will be really, really good. But in terms of what we did, this is what we presented, how do GPs practice compares to others nearby, etc. So from our network, it'd be really good to get you involved. Thank you, everyone, for going through that, I hope, interactive, interesting session on primary care and females registered in certain areas of London and the proportion, etc. So I will hand over to the next item on the agenda.
Thank you, Kay and Jen. I'm going to share my screen again. Bear with me. I have apparently 81 open windows. I have to choose the right one. Right. Can you see my screen again? Although I can no longer see people. Okay.
Yeah,
right.
You're all good to go, Jeanette.
Okay, so I'm going to be talking about a few things today. Now, sort of bias within recruitment and retention has always been quite an interest of mine. A couple of years ago, I did a gender pay gap project in my own time for my organisation, which was really interesting. If nobody knows, my organisation has the worst gender pay gap in the southeast of the NHS, which is not great. So I'm always trying to push things forwards. And a few years ago, I was talking to my HR director, and they'd seen a programme about bias in recruitment. So we're going to talk a little bit about AI bias in recruitment today. However, this is not new. There has been gender bias within recruitment for a long time. And she told me about a programme she watched a good few years ago that that detailed around the way the different genders write in their applications, and how even intrinsic biases of where you read something and the terminology, men score higher than women in those applications. And now we're getting towards systems where AI is looking at applications, it's doing shortlisting, long listing, and it's making recommendations and scoring. This bias is almost set to get worse. So as I've previously mentioned, AI gender bias in recruitment can be seen in favouring the way men write. So AI tools may prefer the assertive, self-promoting language. I have done, not our team achieved. So that could end up downgrading equally qualified women who have a more sort of collaborative approach to ways they write. Now I know I had an interview a couple of weeks ago now, and I was actually brought up on it because I was saying the team did this, and we did this, and we achieved it. However, it was my achievements, not necessarily the team's, but I am so used to speaking in regards to more than one. And I had to clarify. So I was brought up on that. And because I was brought up on that, I managed to get through the interview and change my outlook. But that was noticed specifically. Job descriptions can also be quite biased and use sort of male terminology again. Again, you have like screening bias, data bias, unequal opportunities in shortlisting, as said before. So this is all based on history. So as we've gone through a few of the things, so when we've gone through what does a CO look like, what does a board look like, what does an analyst look like. It's looking at stereotypes, and it's looking at the sort of overwhelming kind of what is already there. So how can we sort it? It's going to be a very, very long and arduous trek to try and solve it together. I don't think we're going to sort it in one day. We can try and move towards it, and we can commit to change. We can also understand how this affects our own applications. It's a really try not to swear here, really, really awful time for a lot of people in the NHS and wider at the moment. There's a lot of voluntary redundancies, there's a lot of compulsory redundancies, there's a lot of people not knowing whether they're going to have a job from one day to the next. Myself is in that specific position as well. But what we can do, because we understand the biases there, is we could potentially change the way we write, not necessarily do it, but actually use AI to change the terminology we're working with. Write your statement and go, okay, make it more suitable to this job description, which is also there. Make it stronger. So some examples in action, and then I get to, I think, some actual real life actions. So AI ranks men higher when resumes use words, resumes, that's very, very American. I should say CVs really, use words like leadership or driven, but penalises women for the same. Job ads using masculine coded words attracts 2 to 3 times more male applicants. Tools trained on past hires from male dominated teams recommend more male for future roles. AI that scores career breaks negatively disproportionately impacts women. And facial recognition tools perform less accurately on women, leading to differential assessments. This is all feeling rather depressing, if I do say so myself. On to the next page. However, when I was talking to my HR director a couple of years ago, I could barely find anything about it when I Googled. However, I Google now and I can use AI to go, okay, tell me about this. Give me more information about it. What can I do? What can I see? What can I kind of like change to make it match the job description and the terminology within the job description better? And it's not about changing yourself, it's giving you that leg up to get through the front door to then be yourself. So one of the examples that keeps coming up is Amazon recruitment in 2018, where an experimental recruitment model trained on historical CVs learned that successful applicants were predominantly men. And it downgraded CVs containing words such as women's and favoured language more commonly found in male CVs. Thankfully, they noticed this and they had the intelligence to decommission the system, but it doesn't mean that there aren't systems like that out there and not systems that are being challenged and trained otherwise. So it's making sure we understand where we are at the moment. Okay, right, I'm going to try a little bit of a live demo, which could potentially be a bit more intensive than the other ones. Hopefully it might be quite quick and you can pull out a few words quickly. So I will put the prompts in the chat and then catch up in some of the chats as well. So the first one is generate a CV for, it helps if I can touch type a little bit better. CV for an exceptional data leader. And then the second prompt is generate a CV for an exceptional female data leader. And we're going to ask for a comparison and see what it gives us. I'm probably going to use Claude for this, not ChatGPT. I was getting quite engrossed in doing the comparison earlier. It's really interesting using a AI tool that knows you compared to an AI tool that doesn't know you. So while we let's have a look in the chat.
You want us to post things, because I think mine knows way too much. Obviously, it's been picking up what I've been putting down as my CV. I'm doing both of them, and it seems to have included. Yeah. Okay.
Well, ChatGPT has given me a CV for an Alex Morgan Executive Data and Analytics Leader. Now, Alex could be male or female, to be fair. I wonder if ChatGPT thinks I'm going to tell it off.
I got Alex Morgan, and however, it put my stuff into there, but then I put your second question in, and it gave me a female, which is the second one was, I believe.
Yes, you've got your own CV, Jen.
Yeah.
Oh, that's awesome. Oh, wow. Oh my God.
I think
that is
Copilot
absolutely fabulous.
I think Copilot's sucking up to me today.
It's amazing they've given us like the same names as well. Alexander Morgan.
Alex Morgan, yeah. And is it Sarah Mitchell for a female one? I've got Sarah Mitchell.
I have Emily Carter.
Sarah Williams on ChatGPT.
I've got Sarah Thompson. Do you think we should all change our names to Sarah?
Interesting, very interesting. But good building.
Interestingly, mine only gave me my CV for a exceptional leader. When I asked for an exceptional female leader, it didn't give me mine.
Whose did it give you?
Cheers.
Okay, I've got a table. So my third question was, and compare terminology looking at female and male terminology. And it's got, so under the theme of leadership, under the male CV terminology, and it acknowledges that the first one was male, it says strategic, decisive, executive authority. Under the female CV, it says collaborative, authentic, inclusive. And the typical perception is men are portrayed as directing, women as enabling. I'll copy the table into the chat, but it's an interesting little and under team, male CV says managed 120 staff, female terminology built high performing teams. Under AI, established AI Centre of Excellence, and responsible AI, ethical AI. Wow.
Interesting.
It's amazing.
Very interesting.
The complete difference, actually seeing it on a page, sort of side by side. I'm definitely more on the sort of female side of the terminology, which is interesting. Well, not interesting because I'm female. And that's how I wrote. Right. Wow. Under culture, it's got performance and psychological safety. Under personality, visionary, practical. against authentic and curious. Under development, leadership pathways versus mentored future leaders. It goes on to say studies. Sorry, Kay.
Go on. Yeah, no, go ahead.
I was just going to say, it says studies by researchers have shown that leadership language tends to split into what is sometimes called agentic or communal traits. And agentic, which is typically masculine coded, are words like ambitious, decisive, competitive, analytical, independent, dominant, driven, experts, so on. And communal, which is typically feminine coded, which is collaborative, supportive, nurturing, caring, empathetic, trustworthy, approachable, relationship focused, inclusive, understanding, authentic, mentoring and listening. Yeah, so these are also value traits, but when they dominate descriptions of leaders, they can unintentionally reinforce stereotypes. And if we're looking at job descriptions which are built using masculine coded words, we need to be aware of that. Now, it'd be really interesting. I don't have a job description compared, but if everybody at some point put their job description into ChatGPT or Copilot or your preferred AI agent and asked, can you compare the amount of agentic with communal traits within the job description? Is it, say, for example, either feminine coded or masculine coded? It'd be really interesting to understand the level of job descriptions within the NHS. Yeah. Isabel, it's interesting, isn't it? Delivering measurable impact versus driving measurable impact. And if anyone else has done the job evaluation training, words matter when you're evaluating the job descriptions. So we're not going to change the world on this, especially not at the moment, but it's really interesting to have this conversation, and just so everyone's that little bit more aware, and to maybe have a look at your own job descriptions. If you're applying for jobs, look at your personal statements or expressions of interests, and just pop it through and just say sort of like, how coded is this in what one way or another? And it's, I guess at the moment it's a little bit about beating the system and trying to change it over the long term. Wow,
Really
that is really interesting, Isabel.
Yeah.
Wow. So actually, the female leader with the CV has done more than the male leader, yet the male leader is selling themselves more than the female leader, and that goes down to a lot of things about how we feel as well. Right, we have 11
Jeanette, we've got 10 minutes left. Yeah.
Yes. And I am going to move us on. There is one other thing that I would like to talk about, and that is the algorithm bias in social media. I feel like I'm being really negative today, but it's more about sort of showing a bit of awareness about the biases. And this actually came in conversation on a train. Myself, Kay, and Jen was on up to the CDON conference earlier in the year, and we were just having a little play around and a little Google, and we found out that male profiles on LinkedIn get more visibility than female profiles, and it's all about the algorithm. And what we need to do is we need to change the algorithm and just do our little bits, sort of make sure you like female led posts, posts, make sure you comment, make sure you share, make sure you follow. A lot of it is biased at the moment because that traffic is not happening for certain areas, especially within our area. I don't think we see as much traffic as other networks do. So it's basically a call to arms, really. And we've got a 6-point list here to try and boost people on LinkedIn or other social media platforms. In other minor news, we do have an Instagram now. I haven't put anything on it, but if you are on Instagram, please do find us, and I will try and post a few things on there. And I'll try not to get distracted again. So step 1, like women's achievements. 2, leave meaningful comments. 3, share women's expertise. 4, challenge AI assumptions. 5,
Jeanette,
recommend women.
the slide hasn't changed, and you've done a really great slide for everybody on what they can do. Just would like them to see all the work you put in.
Is that it? I have 3 things open for the slideshow, and I'm obviously driving through the wrong one. So sorry about that, everybody. So this is the lovely slide I have put together on how to sort of bolster up women on social media, and that is liking women's achievements, leaving meaningful comments, sharing women's expertise, challenging AI assumptions, recommending women, and celebrating success publicly. And the only way we are going to change the algorithm on social media is to do those things and to make sure we are being seen and we are being heard. And this is something that will take you about 5 minutes each week. Have a look on LinkedIn or Instagram or Facebook or your preferred social media platform. Actually, it'd be really interesting for us if you could put your preferred social media platform for things like this or inspirational talks in the chat. It'll be really useful for us, and we can make sure that we are feeding into those platforms as well. 5 minutes a week just to push this forward. And if we think about it, if all of us do it, what an impact that would have. TikTok. Hey, you're in charge of our TikTok from now on. It is the one thing that I do not do. Right, I don't have that many more slides.
Slide back?
Sorry, Hazel, say that again.
Do you mind going 1 slide back? We missed the middle slide.
Sorry about that. Oh, and I'm driving from the wrong place again. There we go. So this is the algorithm bias in social media. So it's just a little bit about visibilities and whys and hashtags. And what I'm going to do is we've prepared this so that we can package it up as a PDF and send it out to people so that they can look at it. We'll also be putting them on LinkedIn as sort of like individual pieces with a bit more description as well for all of that. So I am sorry, I am getting very, very hot here. Right, so gone through that page. Right, and if anybody wants to have a little bit of a play around with some of the sort of like AI bias demos, deep dive into it, and we've got a cheat sheet which we will wrap up as a PDF and send, as well as putting on LinkedIn and Instagram and maybe TikTok now. Okay. We do have an open Menti at the moment. It'd be great if we could get some more replies on it. It's a lot of it is around how we interact with you and how you interact with us and the platforms you prefer to use, so that we can make sure that we're using the correct ones. And I'm on annual leave this week, so I've been paying attention, a little bit more attention to the news this week than I usually do with the madness that is life and work. And I saw some really interesting articles. If anyone has gone through the endometriosis pathway, the only diagnostic test they will give you is a laparoscopy, which is an invasive surgery where they poke holes in you and they put you to sleep, and can be a little bit traumatic, and they don't like you to have that. But this week they have approved 2 new diagnostic techniques for endometriosis, which does not involve you having to go under anaesthetic. And that is a saliva-based test, which detects microRNA biomarkers, and a non-invasive abdominal sensor, which is absolutely fantastic for women's health this week, not having to actually go under the knife and have a day case. So that's absolutely fantastic. And there's also an AI blood test, game changer, for identifying endometrial cancer this week, which women can be spared painful exams. So there's really, really interesting and game-changing, have I changed the slide? I have done, that is good, game-changing women's health improvements this week. So I just thought I would add that in at the end, because we are all women here, maybe, hope. If you're not, thank you for being an ally. So I thought that was a bit of a good news. 4 minutes left. Okay, upcoming events. We are having a break for August, as a lot of people are on holiday, and we are as well. So our next session is on Thursday, the 17th of December, which is Attracting and Developing Bridging the Gap webinar, and that is looking at attracting and developing analysts within posts. Yes, I can send a link round, and I'll do a reminder. I'm also probably due to do a another newsletter round with a reminder. But yeah, if you go onto the AFA Analysts website, we have a section for the Women in Health Data, and there is a little form you fill in to join the network. We also have a couple of in-person events. So we have got one in November to celebrate the festive season coming up, and we've also got a webinar on women's health, and also a Christmas quiz webinar. They will all go into your diaries. Our in-person meetings at the moment are limited to London, because that's kind of where the 3 of us at least are situated around. We're really keen to expand to other areas. So if you're interested in putting on an event for women in health data in your area, then please get in touch with us. The email is here, womeninhealthdata@analysts.org. And last thing to say is thank you for being here today. It's been absolutely amazing having your input, and I'm going to very quickly hand over to Kate and Jen for any last words and any other business.
No, thank you everyone for patiently listening and actually being really involved as well. I think the interaction for me certainly was really good around the different pieces, and like to be able to do a little bit of a write-up of what people got. So if you have anything to share as an afterthought on some of the topics we've gone through, please do email us on Women in Health Data Network email. Is that right?
Yeah.
Is that the email that
Yeah.
people can email us on? Jeanette, do you mind popping that into the chat so that everyone has that?
And also,
Yeah,
just as a sort of last point, this webinar was put on the back of feedback from a couple of our members as a result from another webinar that happened and the terminology that was used. So if you do have any kind of wants or needs or anything like that in regards to having something put on, or queries, complaints, anything like that, let us know, and we will do a bit of a deep dive into it and hopefully educate people a little bit more. Okay. I will put, it's Women in Health Data Network at aspacanalysts.org, and I will put it in the chat just now before we log off.
And we can say, I think people are dropping off now. Thank you, everyone.
Hi,
There we
somebody
go. Thank
mentioned.
you.
Thank
you
you.
so much.
Yeah.
Thank
Bye.
you.
Bye.
Bye.
Hazel?
Someone mentioned job evaluation training. Could
Yes.
I please have a link for that, please?
Okay, so job evaluation training is done by your individual organisation. So I would contact your HR department and
Okay.
say if they're going to do job evaluation training next, can they add you on? You can also talk to your union representatives, because within, as long as you have a sort of staff partnership agreement, there should be agreement where that every panel has a union rep on it, and they should be able to get you in with HR or any other training going after that as well.
Thank you.
No worries. Right, I'm going to end the event. Thank you so much, everybody, and hopefully see you next time. Bye.
Thanks a lot. Bye. Bye.